create a file, and that file contains a series of lists. Each of those lists are vital to you. One of those lists that I always talk about is your medication list. Knowing the medications that you take, the dosages, and the frequencies, that allows you to be able to let the hospital know, be able to let the doctors and the staff know. So now they can cross-reference what they see in their computers and what they know. For instance, you take a certain medication, they know that they can't administer another medication because there may be some counter effects. That's important to you because you don't want to go through the side effects or possible illnesses related to hospital error for them not knowing that you were taking a certain medication and they administered some other medication that counteracted what you were taking already. And it may place you in a challenging situation. It might even be detrimental in some cases. That Medicare Go bag, it's not just a bag. That bag can possibly save your life. Another thing that I talk about in that series of lists that you keep in your file is a contact list. That contact list will have your doctors, your specialist information, your insurance information, your insurance agent's information, and the names of people that are assisting you, friends or family. If there's some emergency that occurs while you're in the hospital, they know who to reach out to. And that's vital and important to you. This Medicare Hospital Go Bag is a lifeline. You put your material in, you do it early, you make sure that you have it in the event it's going to work to your event. Another thing that I suggest that you do in that file, create a to-do list. Remember, you're going to be in a hospital and you might be there for 15 days. And life doesn't stop just because you're in a hospital. So a to-do list means that you can reach out to the people that are assisting you and you can ask them to address certain things. Say you have a dog that needs to be walked. You can ask whoever is helping you out, can you do me a favor? Walk Fido today. Or you might have a cat that needs to get fed. Ask the person who's assisting you, hey, can you feed Max for me? That's the benefit of having a to-do list. Everything that you're doing will impact you. So why not do your due diligence and make sure that you have everything addressed the way it needs to be. Having a to-do list is important. You have a to-do list when you're not in a hospital. What makes you think that your to-do list just goes away? If you don't pay attention to it, it intensifies. So stay on it. Another thing in that file is a needs list. That list is about you. Think about this. There may be some things that you're allergic to. The hospital may have a record of it in this computer database, but they might overlook it. But when you tell them that you're allergic to latex or you have nut allergies, you have now put that information out there so that they know, I need to make sure that we're not using latex products with this patient. I need to make sure that when we're serving breakfast, lunch, or dinner, that we don't have anything with nuts on it. You might be a person that doesn't eat pork meat. The hospital and the administration and the staff, they need to know this. You don't want them cooking with pork products like pork fat or anything like that. You definitely don't want them serving you anything that has pork in it because they may make the mistake of serving it to you because they don't know. The goal is to reduce the possibility of error. That very simple Medicare Go bag is not just a bag for you to put your clothes in. Definitely put your clothes in. You might be in a hospital for, like I said, 5 days, 10 days. Make sure you have some comfortable clothing, some night clothes, some slippers, a house coat, these type of things. You want to be as comfortable as you can in this uncomfortable environment. it is a hospital. Most people are not comfortable in a hospital, but you can get comfortable having the things you're accustomed to. It's not going to alleviate the situation, but the goal is to reduce any levels of anxiety or stress. Have your favorite toiletries. Maybe there's a certain cologne or perfume that you like to wear. Makes you feel better. In addition to the soap that you use or the toothpaste that you use, you know that there's a certain thing that you want to have versus the hospital brand. Because they're not going to cater to your specific need, but you have it. As long as you have it, you're good to go. Make sure you have some type of entertainment. That is crucial because there is a extreme upcharge the minute you turn that television on. When that TV's on, you're going to get charged for it. You're going to get charged. It's almost going to be like the cost of going to a movie. What I recommend is that you pre-plan and you pack your forms of entertainment. Maybe there's a book you've been wanting to read. There's an opportunity. You might have a few crossword puzzles that you want to complete. Pack those. You might have a streaming service. You like to watch a certain series. You download that streaming service to your laptop or your tablet or your smartphone, and you have it. You don't have to worry about the television and that charge related. You have all the entertainment you need, and it's what you want. It's not based on whatever's available. These are the things that are valuable when it comes to having a Medicare Go bag. Now that we've covered what items need to go into a Medicare Go bag, the next video focuses on how to organize it, where to keep it, and how often to review it. Don't forget to subscribe to the A's, B's, C's, and D's of Medicare, and like these videos so YouTube knows I'm providing valuable information and strong advice to my audience.